Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. President Muhammadu Buhari receives members of the Presidential Task Force on COVID-19 at the State House as lockdown ease expires tomorrow. National Universities Commission prepares to reopen universities after the forced closure due to the coronavirus pandemic. And global deaths pass 700,000 as more than 11 million people recover from COVID-19. And the Nigeria Center for Disease Control (NCDC) announced 14 deaths in 7 states in the last 24 hours due to complications from the coronavirus. The states are Taraba. 4 deaths were recorded there: Edo, the FCT, Ondo, Adamawa, Osun, and Plateau states. Testing nationwide has now scaled the 300,000 mark after 15,088 samples were tested, and it was recorded inclusive of a backlog in the last 1 week. This comes as the country continues to record relatively low infections of the virus, with the NCDC announcing 304 new cases last night. The same figure recorded on Monday, apart from the 288 cases yesterday, the lowest since June. The latest cases were recorded in 18 states and the Federal Capital Territory, with 90 infections recorded in the FCT, Lagos next with 59, Ondo 39, and a few other states. With the latest figure, the total confirmed COVID-19 cases in the country stands at 44,433, and 31,851 patients have been discharged. And now, talking about the cases discharged, according to the Director General of the NCDC, Dr. Idris Abdullahi, more states may discharge patients who have recovered from COVID-19 in the next few weeks. Dr. Idris, in a tweet today, says the center is providing guidance to states to report cases that have recovered but were being managed at home. He said that Lagos State has done so following the August 4th figures on the number of discharge cases in Lagos of 10,946 people recovering from COVID-19. The figures are set to be recoveries of home management over a period of time. In the meantime, the NCDC has added the General Sani Abacha State Specialist Hospital, Yobe, to the NCDC Molecular Laboratory Network, bringing the number of laboratories to test for COVID-19 in Nigeria to 62. Now, President Muhammadu Buhari has received a briefing from the Presidential Task Force on COVID-19 at the State House. Members of the task force present were the Secretary to the Government of the Federation, Mr. Boss Mustafa, who is also Chairman of the PTF on COVID-19, the Minister of Health, Dr. Sage Hanire, the NCDC DG, Dr. Idris Abdullahi, and the National Coordinator of the Task Force, amongst others. All were seen wearing the face masks and maintaining physical distancing. This is as the 1-week extension of the second phase of the gradual lockdown ease announced on Thursday last week expires tomorrow. According to the SGF, the Eid al-Kabir holiday coincided with the expiration of the current phase of the ease of lockdown. The PTF chairman on COVID-19 also said the process of submitting interim reports and measures for the next steps had since commenced and reached advanced stages. Nigeria has now tested over 300,000 samples of the coronavirus, with more states taking testing to the communities. For a further look at the virus in communities and the challenges that exist on the field, Dr. Idris Abdullahi is a lecturer, medical lab scientist, and virology specialist, College of Medical Sciences, Zaria. He joins us from our Abuja studios. Thank you for joining us on the program.
Thank you. Thank you for having me.
All right, Dr. Abdullahi, let's start with the number of recoveries we're seeing in Lagos. It appears that the home care model is working.
Yeah, for me, I think it's a good one. Actually, towards the middle of the coronavirus in Nigeria, Nigeria has been saddled with a lot of economical issues, and then government thought of a kind of delving into managing these people at home. So far, I think based on the recent results, this model should be a very good one. I think I will suggest that other states should look into it, study it properly, and see how they could adopt it within other states, especially states that have high reported cases such as Ogun State, Abuja, and so on and so forth.
Let's talk about the experience, your experience testing for coronavirus in communities. What has that been like?
Well, for me, I don't think it's sufficient, although there is a sustained level of improvement in Nigeria. But considering the national population in Nigeria, I don't think it's sufficient enough for us to say it's adequate. For instance, in Gwagwalada suburb and other slums in Abuja and other neighboring states of Abuja, you notice that sample collectors are deployed to these areas on few occasions, say twice or even 3 times in a week. Maybe this could even reflect the low figures we are having these days. And another issue is that these people that collect these samples, some of them are not that trained or retrained on the technicalities of collecting quality samples that will yield a very good result for the COVID-19 testing. For me, I think we still have a long way to go. We still need to train people, because as it is now, COVID-19, it's not something that will go very soon. When you check, the incident rates keep on rising everywhere in the world. So I think there's need for retraining of people that collect these samples and also know how these samples could be actually be manipulated, transported, so that it could yield a better molecular testing result.
I guess the PCR is still the gold standard. Are there any other limitations?
Of course, so far WHO have recommended the RT-PCR to be the gold standard of COVID-19. But as you know, it's a laboratory-based test that require competent people that are well trained in the use of these procedures. You know, one thing is to know the protocols. Another thing is to know the technicalities. Because we've been having cases whereby people come for testing, getting negative result testing, but after some days coming out to be positive. I think one of the issues there is the drawback of the procedure that could have emanated from the personnel that is handling the technique. And I also think that one of the major limitations of this technique, that is the RT-PCR, is that when you consider recent findings about the coronavirus itself, there are lots of mutation going on. In fact, recently, Professor Christian Hype in Lagos reported a widespread mutation among some people that were diagnosed of having this COVID-19. This mutation might actually affect the gene region that is being used for the primers in synthesizing this, primers that are used in this RT-PCR. I think there is need for a kind of a continuous surveillance of this virus itself to know the extent, the degree of this mutation and the impact of this mutation on the primers that we use for the testing. Because as we know, these primers actually target various regions of the virus. Today, there could be a mutation that affects the S, or the spike protein, and if it affects the spike protein, it's definitely going to affect the RT-PCR result. Another limitation is during the sampling. Sometimes these viruses, they replicate in the lower respiratory tract, whereas samples that have been collected for this RT-PCR testing are mostly upper respiratory tract samples. So in that situation, people may end up getting negative results, whereas they're actually having the coronavirus, hence transmitting the virus in the community, posing difficulties in interrupting this transmission. That's why we actually need competent people, medical laboratory scientists that know the quality protocols, quality procedures that helps to ascertain or to assure the precision and accuracy of this testing.
All right, we'd like to thank you, Mr. Abdullahi. Thank you so much. Lecturer, Medical Lab Sciences, Virology Specialist. Thank you for joining us on the program.
Thank you so much.
Now, an Air Peace flight conveying 306 evacuees arrived at the Nnamdi Azikiwe International Airport, Abuja, this morning from the UAE. While some evacuees disembarked in Abuja, others proceeded to the Murtala Muhammed International Airport, Lagos. According to a tweet by the chairman, Nigerians in Diaspora Commission, NEDCOM, all evacuees tested negative to COVID-19 and will proceed on a 14-day self-isolation as mandated by the Presidential Task Force on COVID-19 and other agencies. Now, the National Universities Commission, NUC, says preparations are in top gear to reopen the nation's universities after the forced closure due to the coronavirus pandemic. Addressing a news conference in Abuja, the Deputy Executive Secretary of the Commission in charge of academics says the Commission is collating data on the level of preparedness by the various universities through their vice-chancellors to determine if the universities are safe for resumption to both academic and non-academic activities. He adds that efforts are ongoing to resolve the strike as well by the Academic Staff Union of Universities that threatens to further delay the resumption of academic activities.
Not less than 32 universities across our university system are involved in different stages of research endeavors that are aimed at galvanizing Nigeria's research, innovation resources towards the development of possible vaccines and, of course, non-vaccine related solutions to the ravaging pandemic. Other ACEs in the university system that own testing and screening centers as of to the 2nd of June this year, because there are many more that are coming on board in this regard. Those that have been captured as of 22nd of June include screening centers at ABU Zaria, Bayero University, Kano, the University of Lagos, University of Benin, University of Port Harcourt, and the University of Jos. It is noteworthy that the way the ACEs have been found readily responsive and useful to mitigating the COVID-19 pandemic demonstrates how the Nigerian university system can be effective and relevant to national development if research is valued and adequately funded.
Let's go over to Anambra State, where traders, transporters and other groups are beneficiaries of the 10% tax refund approved by the governor of Anambra State as part of COVID-19 stimulus package. The Anambra Internal Revenue Service, in a stakeholders summit, sensitized the different groups while appreciating the people for paying their taxes in spite of the economic situation occasioned by COVID-19.
Payers of personal income tax in Anambra State are being taken through the process of reclaiming a 10% refund granted by Governor Willie Obiano as part of the state's COVID-19 stimulus package. The aim is to cushion the effect of the pandemic on the poor and the elderly. The Chief Executive Officer of the Anambra State Internal Revenue Service, Dr David Nzeku, gives a background of the program and what beneficiaries should expect. To claim the refund, beneficiaries are to log into the state government's website and provide their personal details as requested.
The government announced a package that included a waiver of daily operational permits that were paid by transporters in the state, announced tax relief package for traders and business owners in the state, and announced the extension of various assistance to the elderly and the most vulnerable people in the state. So it was a complete package that touched every individual in the state.
The Commissioner for Information says such a gesture to meet people at the point of their needs in critical times is always a priority for Governor Willie Obiano.
When there is a recession or a serious economic crisis, the right thing to do is to empower the poorest, the weakest in society. This is the right thing to do. and of course, is morally appropriate. We must keep on showing solidarity with the human family, especially the downtrodden, the disadvantaged.
The State Revenue Service also used the opportunity to have different groups gathered to enlighten them on the innovations by the Revenue Service, which supports taxpayers and revenue payments in the state.
Stay with us. We have more on the COVID-19 update when we return. The Kaduna State government has assured nursing mothers of creating an enabling environment that will allow for exclusive breastfeeding of their babies, especially during the COVID-19 pandemic. This is as Nigeria joins the rest of the world to observe the 2020 World Breastfeeding Week. At the event, the Kaduna State Commissioner of Health, Dr Amina Baloni, called for finding innovative solutions to ensure that access to essential services for exclusive breastfeeding is not disrupted by the pandemic.
While breastfeeding is a natural process, it is not always easy. Mothers and families need support for the women to get started and to sustain breastfeeding. In this vein, skilled counseling services can ensure that mothers and families receive this support, along with the information, advice, and reassurance they need to nourish their babies optimally. Breastfeeding counseling can help mothers to build confidence while respecting their individual circumstances and choices. Counseling can empower women to overcome challenges. During the COVID-19 pandemic, it is even more important and paramount to find innovative solutions to ensure that access to these essential services are not disrupted, and that mothers and families continue to receive the breastfeeding counseling they need while observing all necessary safety and hygiene precautions.
Joining us via Skype from Ikeja is Dr. Flora Mwagabo, a public health specialist. Thank you for joining us on the program.
Thank you for having me.
All right. Now, according to the World Health Organization, not having access to a mother's milk has been responsible for almost 1 million deaths, child deaths across the world. And seeing as we're in a pandemic, how does COVID-19 affect breastfeeding mothers?
Okay, so if you remember, in April, when there was a lockdown in Lagos and a few other states, there was basically no movement. So a lot of people had challenges getting to a health facility, including mothers, pregnant women. Some of them had some very serious problems getting to the hospital. So for a pregnant woman for a mother who had just delivered and was having challenges getting to the hospital, you can imagine that, assuming she had problems breastfeeding and needed help, she probably would not have been able to get that. Now, prior to delivery, any pregnant woman at that time who was in the late trimester would also have suffered some challenges because, during the antenatal classes, they give them a lot of education, skilled counseling on breastfeeding, and a lot of support. So during that lockdown, a good number of them would have had challenges. Breastfeeding isn't as easy as we tend to think all the time. Sometimes mothers do have some very severe challenges, maybe pain when breastfeeding or the milk not flowing, and then they would need the help of their health provider. If they were not able to access these services, which a good number of them were not able to at that time, then there would have been a problem with breastfeeding.
So it's a lot of support that is needed for them and also for perhaps other areas in healthcare for Nigerians. But looking at the overall efforts at flattening the curve, what do you say to some people who feel that we're entering the early phase of flattening?
Well, I'm not one of those who can really see the flattening yet. And that's because the behaviors I see out there are not encouraging that flattening we're expecting. The government is doing everything in their capacity across board, but I think we the people are not helping matters. So I'll tell you something. Recently, I was out and somebody said to me, Madam, you still they wear mask? If you go outside, you will find that a lot of people are not wearing masks. They're not distancing. Yes, the economy has been opened up, but we expected to do the needful to reduce the risk of transmission and acquiring new infections, but that is not happening. So I sit back and I wonder, how do we flatten the curve if we are not doing the things that we need to do to flatten the curve? While government is doing things on their side, there is a lot for us to do, and we have not gotten to that point yet of being compliant to be able to flatten the curve.
Finish line is sweeter, but there is bound to be fatigue in the response to stopping the spread, isn't it?
Well, yeah, we're all tired, but you see, we really need to belten up, because we are not out of this, and it does not look like we're going to be out of it very soon unless we all put our hands together and make sure that this happens. And that will only happen when we do what we need to do.
All right. Thank you so much, Dr. Flora Mwagabo, a public health specialist. Thank you for joining us on the program.
Thank you. Have a great day.
You as well. Now, the World Health Organization has called on young people to reconsider their partying habits to help reduce the spread of COVID-19. Many countries are beginning to see a higher proportion of new COVID-19 infections among young people than during the earlier stage of the pandemic. This comes as more than 700,000 people have died from coronavirus worldwide.
The French government has come under fire over its free-for-all COVID-19 testing policies as queues knocked out some testing centers in the capital, Paris, and at sites across the country amid a flare-up in infections. One leading federation of laboratories said an abrupt July 25 decree to make testing free of charge and without prescription piled pressure at the time many staff go on holiday. The country, like its neighbors, is witnessing a mushrooming of new coronavirus clusters. Meanwhile, authorities in Paris are expected to make the wearing of face masks compulsory in certain busy streets and other outdoor places in the city. Over in the UK, lockdown restrictions have been imposed in Aberdeen due to a coronavirus cluster in the city. Restrictions are also expected to be introduced in another city in northern England in the coming days after a rise in COVID-19 cases. The South African government says it is successfully managing the biggest COVID-19 surge on the African continent. The number of infections in the country passed 500,000 last week, a new milestone in the pandemic. The health minister, Wele Mkize, says the government has coped with the surge thus far, despite what he called challenges and glitches. Finally, the daily number of newly confirmed COVID-19 cases in India have exceeded 50,000 for the 7th consecutive day. The Ministry of Health says as many as 52,509 new COVID-19 cases were detected in the past 24 hours.
So it's not yet Uhuru. Continue to wear your mask and take responsibility. Our website, channelstv.com, has more updates on the pandemic. All you need to do is log on, access a lot of stories there. You can see that's our website, channelstv.com. That's the program. Thank you for watching. I'm Millicent Walker. Stay safe.